Good evening, everyone. Today, with our series, which we started from January, yoga and modern medicine. So in the first week, we covered yoga and respiratory system. Second month in February, we did yoga and cardiovascular health. And the third month, we did the yoga chakra system and the endocrine glands. So today we will see how yoga and mental health, uh, how yoga can help in maintaining a very good mental health. And I'm really thankful for Dr. Ali, who has obliged and spending his precious time with us and giving a lot of information about the yoga and the mental health issues. So now I'll pass it on to Nagesh so that he can introduce Dr. Ali, because he and Nagesh are very good friends and they've worked together.
Hello all. I've been seeing Dr. Ali for quite a while, and what can I say? I mean, I remember one thing which he always told me that at some point we were chatting on counseling issue, and he said everybody in this world needs counseling at some point, so don't worry about it. I remember that. And the other thing he said that everybody should after a certain age start taking melatonin because I was talking about how miserable I was not sleeping properly and all. So I enjoy really talking to him all the time. And we had some of the best moments at Chippenham when I used to work there. Dr. Ali did his medical. He originally hails from Kashmir region, and he did his medical school from MS Ramaya Medical College in Bangalore, and he trained at NIMHANS for a while, and then he moved to Boston and Harvard University, and he did his psychiatry residency there. After he finished training, he worked at Mount Sinai Medical School in New York. He was associate professor there for a while, and then he moved to Richmond. He's been in Richmond for a while, and primarily I used to see him at Chippenham, but now I think I have moved out, and he also has moved out of Chippenham. Even though he goes there, it's one of the inpatient psychiatry facilities, Chippenham Hospital, and now mostly he's based at St. Mary's, where he occasionally bumps into Dr. Anil Kumar, I guess. And he carries vast experience with him, and it's really a pleasure to talk to him about mental health issues, and his insights are very powerful. And here you go, and I'm glad we have an opportunity to have him on our forum to talk. In fact, he's the one who directed us to yoga at some point, so he has a lot of insights, and it's a pleasure to have him. And please welcome Dr. Ali for today's session. Thank you.
Thank you, Nagesha. Thank you for your kind words. I really appreciate you saying that. And it's been a pleasure knowing you and working with you for many years. And I do miss working with you early in the mornings in the OR. I think one of the great things about Nagesha is that he is so humble and self-effacing, even though he has a wealth of knowledge, and I was always impressed by his willingness to help patients with everything that they needed, including pushing the bed for them and being available for them. And thank you once again for your introduction. Hello, everybody. And today, I guess As a continuation of this series, we are going to talk about mental health and the effects of yoga on this. And hopefully, I'll try to not bore you with too many scientific facts. The series is titled Modern Medicine, and I've tried to present a perspective of yoga and its effects on mental health from a modern scientific perspective that is hopefully up to date. I'm going to try and share my screen with you, and hopefully this will work. Um, is, can you, Kusuma, can you see it? Yes. Okay. Okay. All right. All right. So my title is Yoga and Emotional Health rather than mental health, although they are probably interchangeable terms. But I think emotional health encompasses a wider range of health issues compared to just mental health, and I want to talk about it all. I'm sure all of you are very familiar with yoga and what it means, but maybe there are people in the audience, especially in the future, who will look at this and want to know what yoga means. And I also want to talk about aspects of yoga which are related to what I want to talk about today. And in the Bhagavad Gita, Krishna speaks of the four types of yoga and the equivalents of the yoga in the English language. I've tried to present and bhakti, which stands for devotion, jnana, which stands for knowledge, karma, which probably stands most for action, and dhyana, which is concentration. And I wanted to highlight dhyana because that is what yoga is most commonly associated with around the world, but maybe not so much in the US. And it is what helps me tie it back into mental health. And I wanted to include this passage from the Gita. There, having the mind actively focused upon a single point, with thought and sense activity controlled, sitting on a seat, one should prepare for purification of the self with an aligned body, head and neck, keeping these steady without movement, focusing the vision towards the tip of one's nose without looking about in any direction. So to me, this passage embodies what makes yoga useful for improving oneself and improving one's emotional self. Um, Now, the goals of yoga are many, and it's been around for 2,000 years, and there are so many different schools of yoga that I don't really want to get into all of that. But as in a general sense, yoga is meant to be a system of increasing your awareness of your own self and decreasing disease. And one of the reasons yoga was able to enter into the mainstream of American and United States thought was by presenting itself as a tool with many benefits, including reducing stress, increased relaxation, and greater flexibility. And it has spread like wildfire through American gyms as something that cultivates aerobic capacity and builds strength. However, one of the things that sometimes has fallen away is the fact that yoga emphasizes essential self-awareness and not just exercise, and that is what differentiates yoga from any other exercise. So yoga tries to cultivate discernment, awareness of the self, self-regulation, and increasing higher consciousness in the individual. And this self-awareness is always compassionate and allows your yoga practice to not be just physical, but to be mental and spiritual also. And again, the, as everybody in the audience knows, asana is the physical part of yoga, but it doesn't always equal yoga. And in American gyms, it's sometimes just practiced as asana. That's not to say that asana is not important. It's vital and necessary in the practice of yoga, especially when practiced under the guidance of an experienced and properly trained guru. And it's integral to yoga, but it doesn't equal yoga. And the reason I spend a little time on this distinction is because the physical distinction applies to the physical part of aspect of yoga applies to a lot of physical illnesses, and then the self-awareness part of it applies to mental health. This is a slide that I put in there. It's from an article that describes how popular yoga has gotten over the years, and it's really a slide that shows the number of articles that are published every year going back to 1948. So if you search on this website called PubMed, which is really the Google for medical literature and where you can search on any topic in the world, the first reference to yoga goes back to 1948. So that was 72 years ago. And until the late 1990s, there was a steady number of articles published, but it was not really a big number. And then in the early 2000s, the number just jumped up. And as you can see, in 2018, there were nearly 500 articles published on yoga in 1 year. And every year since, it has also grown since then. So that tells you the popularity of yoga among medical researchers. And how important it has become as a subject. So there is an organization called the National Center for Complementary and Integrative Health. And in 2015, they published a report on various aspects of yoga. And they reported that it was the most popular form of complementary therapy practiced in the USA. When I say complementary therapy, I mean complementary medicine therapy. And in 2015, 13 million people were practicing yoga. There are some estimates that it's doubled since then. I don't really have the most latest figures. It's hard to keep track of these figures. And out of all the various forms of yoga, Hatha yoga is the most commonly practiced style. And I mentioned that earlier also because there is an emphasis on the physical aspects of yoga. Some of the reasons yoga has become so popular is because it is a low intensity exercise, it's low impact and readily modifiable, and is suitable for aging populations. In the US, the number of the members of the aging population are growing exponentially, and it's very important to have a suitable exercise form that can benefit older people. The journal Medicine, Science, and Sports Exercise in 2016 attempted to classify the place of yoga and exercise, and they reported this to the American College of Sports Medicine, and they classify yoga as a light intensity physical activity, and usually you spend about 2 to 2.9 metabolic expenditures, energy expenditures, according to this. This classifies yoga as light intensity activity, but there are other forms of yoga where you can be more physical and that you can go beyond 3 mets and higher, and that is also possible too. Yoga can be used for people of all ages, for people with physical limitations, for people who want less intense exercise, and for multiple clinical diagnoses, as might have been presented in prior presentations. All right, now, if you really look at the literature on yoga, it's a huge amount of scientific literature that is available. And I was thinking about a good point for me to jump in and something that would be relevant to our perspective of modern medicine. And I think this study that was published in 2019 is probably most relevant for us in that it allows us to look at the effects of yoga on the brain itself, not the benefits that people feel, but something more measurable. So these are studies. This is a study of studies that was published in 2019, and it describes the effects that yoga has on people after they have been exposed to it for a period ranging from anywhere from 10 weeks to 24 weeks. And then they measure the effects of the yoga on the brain, actually on the brain. And you can actually measure these effects and demonstrate differences between groups of people. So there were a total of 11 studies, including in this review, and the studies were of multiple different kinds. They used multiple different ways to measure brain activity, including MRI, which I'm pretty sure everybody is familiar with it. Then there is something called functional MRI, PET, and SPECT. These are all imaging modalities used in medicine for various purposes. And functional MRI is mostly experimental and used in labs, but is becoming more and more commonplace. The authors describe, or the authors only selected studies where they considered what's called holistic yoga practice. And what do they mean by holistic yoga practice? It means that the yoga performed by the subject in the study has to have three elements. It has to be yoga postures, it has to be yoga-based breathing exercises, and yoga-based meditative exercises. So pranayam, om chanting, and the asanas that people regularly practice. So they did not just study one aspect of yoga. So it was a very rigorously done study. And I'll take a few minutes to present the results of the study because I think it's such an important study that I want to describe it in a little bit more detail. So people who are not in medicine and are not familiar with the terminology, I'll try to keep it as simple, but hopefully I can get the gist of the results across here. Most of the studies were done in older adults. In 5 of the studies, it was for people older than 65 years. Because the studies were done in the US, they mostly looked at people doing Hatha Yoga. 2 studied Kundalini Yoga, and 1 studied Iyengar Yoga, which is probably an even more intense form of Hatha Yoga. The kind of studies that they looked at were what is called a cross-sectional study. A cross-sectional study is when you take a group of people who have been doing yoga and study their brains at that particular point, and then compare them to another group of people who are not doing yoga. While there are other studies called interventional studies, where you take a group of people and get them to practice yoga for a period of 3 months, 6 months, and then you look at the changes in their brain. The second kind of study is more rigorous and more accepted as being a better study because you're actually doing an experiment in which you change something in the person's life, and then you look at what effect that change has. As I mentioned, the studies were done in a rigorous manner, and they had very strict criteria for who a yoga practitioner is. So they defined a yoga practitioner as somebody who practices yoga for has practiced yoga for at least 3 years on a daily, bi-weekly, or once a week schedule. So they try to keep that very consistent. The study described the effects of yoga on 2 different aspects of the brain. One was the brain structure itself, which is when you look inside the brain, what are the different parts of the brain, whether they changed, they became bigger or smaller. And then they also looked at brain function, which is whether the brain was using more oxygen, whether the brain was using more glucose, whether the brain was heating up and things like that, whether blood flow increased to the brain. So first I'll talk about the effects on brain structure. There were the first study, one of the better studies was done in women who were 60 years and older with at least 8 years of yoga experience. This study was published in, I think, 2017, and what they looked at is whether these women had a thicker part of the brain compared to women who did not practice yoga. So the area of the brain that they looked at is called the cerebral cortex. Anybody who knows a little bit about the brain knows what the cerebral cortex is. It's the part of the brain that distinguishes us from other animals. It's what makes man the most intelligent being on earth, and really has allowed us to create civilization as we know it today. Without the cerebral cortex, we are more similar to a lot of other animals, including elephants and some monkeys. So this is exactly what they looked for. So they found that women who had been practicing yoga for at least 8 years, their cerebral cortex had greater thickness in several different areas, particularly the areas related to memory and language. And because they wanted to be rigorous, they didn't just compare women doing yoga, they compared them to women who did other forms of activity or who were as physically active, because they didn't want their study to be biased. So they compared these women to other women who were as physically active but did not do yoga. So that's a superior form of experiment, and the results are more valid. And they found that women, even who are as physically active but not practicing yoga, don't have this increase in the thickness of the cerebral cortex. Then there was another study done in 2018 which looked at the effects of yoga on hippocampus. I don't know if the hippocampus is basically the area of the brain which is related to memory, the formation of memory, and also to your memory of navigation. So they looked at people who had been practicing yoga for at least 3 years, and they looked at 3 different areas of the brain: the hippocampus and 2 other areas. One is called the caudate and the thalamus. You don't really need to know what those areas do, but they found that this effect was mostly focused on the hippocampus, and actually they found that these people had better memory than people who did not practice yoga. So again, a very important study. There was a similar study done in 2012 which had similar results, and they found slightly increased thickness of several other areas of the brain, including the area of what's called the limbic system, which is where the emotional system of the brain, and they found that was also slightly increased in size. Now, there are a lot of positive studies, but there was one study which was done in 2015. They looked at 28 young, healthy adults. And these were, in this study, they did not find any difference in brain size in any of the different areas. But that can be partly explained by the fact that younger people are less likely to have deficits which require to be changed by yoga or other forms of exercise. So in general, the effects of yoga are better in older adults than healthy young adults, but the effects of yoga are good in children and adolescents also. Sorry if that was a lot of information. I'm trying to keep it as simple as possible. Then The other study I do want to talk about is this was a study done in India at NIMHANS at my alma mater, and one of the authors was Dr. Gangadhar, B.N. Gangadhar, who's I consider one of my mentors, and he's probably one of the leading researchers on yoga in the entire world. And they used MRI to look at a group of patients who they recruited in their clinics. This was what's called an interventional study. And here they didn't just look at them for one time. What they did was they recruited these people, then they measured different aspects of their brain with an MRI, including the hippocampus. And then they asked them to practice. They came to the clinic for 1 hour, 5 days a week for 3 months under the supervision of a teacher. And then after that, then they did 3 months of home practice. So it was a total of at least 6 months of yoga with 3 months of supervision from a teacher. And at the end of 6 months, they measured their brains again. And they found that in almost all of these people, the gray matter in their hippocampus had increased on both sides, not just the left side. So again, clearly demonstrating the beneficial effects of yoga and actually producing brain changes, which explains why yoga works like it does. Again, just like I said earlier, there are some studies where the benefits are not clear. There was another study done that was done in 2013, and they used Kundalini yoga and Kirtan Kriya for 12 weeks in young adults. This study, there was not much of a benefit, and the size of the hippocampus did not change. So again, there are some negative studies, but there are a lot more positive studies. And finally, there was one very interesting study which was published in 2019, and they tried to go even beyond the level of intervention. So they took 102 young adults as young as age 23 and divided them into 3 groups. So the first group was 39 people who did yoga. The second group was 39 people who did other forms of sport. And then there were 39 people who did not do any activity. And these people were followed over 6 months to make sure that they stuck to what they were assigned to do. So one group did 39 of them did yoga for 6 months, 39 participated in other sports, and 31 just led their lives as they had been without much physical activity. And then they measured their brains after 6 months. And after 6 months, no surprise, the yoga group had increased hippocampal density. Again, so the hippocampus in these people had again grown larger compared to the other groups. And in this case, they used a different technique to look at what is called gray matter. I'm sure everybody has heard of gray matter, but when you say gray matter in terms of the brain, what it really means is that on an MRI, are you looking at the neurons themselves, the brain cells themselves, or white matter, which is mostly the connections between neurons? So gray matter is brain cells, white matter is connection. So white matter is not as important. It's very important for other reasons, but it doesn't usually grow in size. So they particularly looked at gray matter, and they found that the gray matter had increased in size, which is a fantastic study, fantastic finding that you will sometimes see with medications, but this is just from practicing yoga. And briefly, I'll talk about the effects on brain function. And these were 5 studies. They looked at function of the brain rather than the structure. So there are multiple different ways to look at. So for example, you look at whether blood flow changes in the brain, different areas of the brain, whether glucose is the primary fuel of the brain. So if the brain is using more glucose in one area, it'll show up as a hot spot in that part of the brain. So you know that part of the brain is functioning better. Or you can, there are multiple other imaging modalities, which I really don't want to get into. I don't want to bore people, but again, these are very significant studies because one of the important studies was done in older people who actually had memory loss. So these are older people about the age of 65, and they had what's called mild cognitive impairment, and some people consider that as a precursor to the development of dementia and Alzheimer's disease. And they looked at these people and asked them to do yoga for 12 weeks. Especially they did Kundalini yoga and Kriya Kirtan, and they looked at their brains after 12 weeks, and they found that there was an increase in their verbal memories, and this was associated with definite changes in connections between different brain areas. I don't want to use too many technical terms, but in the brain, there is something called the default mode network, or DMN. This is kind of, you can think of this as the resting state of the brain. So if you put somebody in an MRI machine and you look at their brain, or a functional MRI machine and you look at their brain, you will immediately see this state called the default mode network, and you can recognize it very easily. And as soon as the brain becomes active, the default mode network goes away and active mode sets in. And you can actually measure how that process happens using functional MRI. And in these people, the default mode network connected with the language network, and their language usage improved, and their memory for numbers and for facts improved just after 12 weeks of yoga. So this is a beautiful demonstration of the effect of yoga on the brain. As far back as 2009, there have been studies of yoga showing that blood flow improves in different parts of the brain when people practice yoga. And in this particular study done in 2009, they used Iyengar yoga, which is kind of more intense and sometimes can have very quick effects. And they studied this with the imaging modality called SPECT. Anyways, I'll once again apologize for using so many technical terms and going so deep into these things, but the reason I'm doing that is because I really want to emphasize how important it is to understand that yoga is not just feeling better. It is feeling better because it produces underlying physical changes and makes people feel better. It has what's called a neuroprotective effect on the brain. It affects areas for memory, for language, and the effects are very similar to effects that you would see from something like aerobic exercise and mindfulness. Now, even with all of this evidence, the yoga is still not as accepted by the medical community because there is still a need to do even larger studies than this, and to really systematically investigate how yoga works and how effective it is. And eventually, I'm pretty sure that yoga will become a part of mainstream medical treatment. And there are already efforts underway to ensure that this happens. Okay, I just wanted to, these are MRI pictures from some of these studies that have been combined together in one chart. So let me turn on my pointer. So if you look at this study with the blue lines, this is the study that I mentioned in the women older than 60 who had thicker cerebral cortices, and so they take these slices of cerebral cortex, these blue slices, and then they compare it to women who haven't done yoga, and you can clearly see that there is a difference in size. And then the red, the yellow, and the green areas, these are from the study that I mentioned from India, from NIMHANS, where did 6 months of yoga and looked at the hippocampus, and the hippocampus became bigger. And it's hard to see on this, but there is a clear difference between people who did not do yoga and the people who actually did yoga. And this is another slide of the functional studies where all the pink areas that you see in here, all of them are places where function has improved after the practice of yoga. And this is another representation of the, the cortical thickness slides. I know that these are hard to interpret and understand, but I just wanted to present these because it so clearly delineates that yoga is producing changes in the brain. All right, so maybe now I can get into a little bit an area which is a little bit more relevant to what we wanted to talk about today. So if you, as I said, there's a huge amount of literature, so I don't really want to get technical again. And there is hundreds and thousands of articles showing that yoga has good effects on general well-being, mental health positivity. So what does mental health positivity mean? It just means it's a term that is used to describe in one term several different effects, several different aspects of your mental health. That includes feeling psychologically good, that includes life satisfaction, that includes satisfaction in social relationships, and mindfulness. So all of these combined together are called mental health positivity, and very clearly yoga has beneficial effects on mental health positivity. I do want to talk a little bit about what mindfulness is. I'm sure everybody has heard the term. It's used in literature and in the media very commonly, but what it really means is what it says, mindfulness. So being aware of the present moment, cultivating that awareness and going back to it again and again, and to be in the moment itself. And when you're being in the moment, to be kind and curious. So that's what mindfulness means. The other effect that you will see in the research literature is that all forms of yoga seem to help with mental health, including Kundalini yoga, Ashwakriya yoga, Iyengar yoga, Yoga Nidra, Laughter yoga, Sahaja yoga, Hatha yoga, and all of them have been demonstrated to work for different aspects of mental health. The other important thing to note is that yoga seems to be helpful for mental health in almost all ages. For young children and adolescents, there have been reports that 50% of people in this age group will experience anxiety and depression. And the pandemic over the past year has probably increased this number significantly. And children who do yoga benefit and do better with it. There is even a proposal for what's called medical yoga therapy, which is being proposed as an individualized and personal approach to the patient, and is being slowly developed by different groups all over the country and in Canada also. And the fact that yoga is good for mental health is kind of, there's no doubt about it. There's no doubt about it. If you practice yoga regularly, it's good for your mental health. All right. I wanted to include this study because it's relevant to my own health. And the study was done in Taiwan in 2015, and they compared two different groups of mental health professionals. They asked one group to start practicing yoga for 12 weeks, and then the other group, they told them to practice other forms of physical therapy for 12 weeks. Before the study started, they measured their work-related stress, their ability to adapt to stress, and they also measured two physical variables. One is called heart rate variability, and then they also measured what's called autonomic nerve activity. And heart rate variability is an indirect measure of that. And then they asked them to practice yoga for 12 weeks, and after 12 weeks, they looked at their level of stress again, and clearly, mental health professionals who were in the yoga group experienced a significant reduction in work-related stress. They were able to adapt slightly better to stress, and the authors recommended that all clinicians, administrators, and educators should be offered yoga classes as a strategy to help them reduce their work-related stress. There are a few medical doctors today in the audience, and so if you want to feel less stressed, practice yoga. Um, Now, this this slide I put in because I think it's highly relevant today, because yoga is practiced mostly by women, and I could say that women dominate yoga. 70%. In 2015, there was a study where they found 70% of women, 70% of people practicing yoga were women, and that number has decreased slightly, but nobody really has more updated figures than that. There were two studies in India in 2007 and 2013 where they found men predominantly performed yoga, but yoga has been around in India for 2,000 years, and it's practiced much more widely, so I'm not surprised. But anyways, in this study, they looked at women who had breast cancer. This was 2,116 women, 166 women, so it's a large sample size, and they noted their level of stress and their level of psychological distress, how much pain they had, and what their quality of life was before they started yoga. Then they asked them to practice yoga for 6 months, and at the end of 6 months, they found significant improvement in all of these factors, including daily fatigue, quality of life, and their sleep was better also. So this is physical. It's a physical condition which is known to produce significant mental health deficits, and it seemed to improve both conditions. So no, there is no doubt women who are in breast cancer can practice yoga and feel better from that. And very importantly, this is one of the few studies where they actively looked for side effects of yoga, and they didn't find any. In contrast, almost all other Western forms of treatment have side effects. So this is including aerobic exercise that has side effects also, but yoga doesn't. And then I'll probably be done in a few minutes, but briefly I wanted to talk about yoga in what's called major depression. So when people talk about depression, they use the term depression in a general sense, but as psychiatrists, we talk about it in a very specific term called major depression or recurrent major depression, and it's what's called a syndrome. Or a syndrome is a collection of symptoms. So people with depression have a wide range of symptoms, and when you add them up together, you can say that people have major depression. It's one of the most common mental disorders, and 15% of women are known to have major depression. So that's a very high number. It's one of the most common causes for suicide all around the world. And in a few more years, major depression will be the #1 cause for medical morbidity in the world, even exceeding cardiac disease and other forms of disease, including cancer. I have written on the slide that more than 100 studies have been published, but actually that's partly correct because there have been several hundred studies published, but I'm talking about studies which are which are well done, or they have been rigorously performed. And these are almost 100 studies which follow traditions for modern medical studies and use the most modern methods for conducting the studies. So people with depression, their moods will get better, their sleep will get better, they'll have more energy, their levels of motivation and concentration improve, their appetite will improve, and sometimes people with depression lose weight, and that weight gain will be reversed. And if you look at the studies carefully, you'll see that this improvement is comparable to that produced by medications as well as other exercise-based interventions. Canada has this organization called the Canadian Network for Mood and Anxiety Treatments, or CanMat, and they make national recommendations for the use of mental health treatments. And in 2016, they recommended yoga as a first or second line treatment for moderate and mild depression. And they said it has the same effectiveness as other alternate forms of treatment, including St. John's wort, S-adenosylmethionine, and light therapy and aerobic exercise, which are all known to be forms of treatment which are as good as medications for treating depression. The one thing I do want to say is that none of these treatments seem to work very well for people who have severe depression, which is in a separate category by itself, and that there are other forms of treatment used for that. Then there are very similar results for the benefits of yoga and anxiety, and studies have been ongoing since 2008. The effects on general anxiety are very well documented, but the effects on specific anxiety disorders are less clear. So for example, people who have post-traumatic stress disorder or obsessive compulsive disorder, they don't seem to respond as well to yoga, but I can tell you those conditions are difficult to treat otherwise also, so I'm not surprised they don't respond well to yoga. The best effect for anxiety is seen in what's called generalized anxiety disorder. And there was a study in 2019 which particularly showed this very clearly. They looked at 49 women who were asked to do Kundalini yoga. As people here know, Kundalini yoga is a form of yoga which involves mostly chanting, singing in a meditative manner, breathing exercises, and repetitive poses. And so you're trying to activate what is called your Kundalini energy or your Shakti. And they found that this form of yoga has a specific benefit for what's called generalized anxiety disorder, which can be a disabling form of anxiety. All right. Then a brief few words on yoga and what's called serious mental illness. So when I say serious mental illness, this includes schizophrenia, bipolar disorder, and severe major depression. And we know from experience over many years that these conditions are very difficult to treat. They're disabling and last for a lifetime for most people. There are studies done in India at NIMHANS where they have demonstrated that specifically pranayam and some asanas, they improve the quality of life in people with schizophrenia. They improve what are called negative symptoms in schizophrenia, and they improve memory. Negative symptoms means people with schizophrenia tend to become isolative. They don't interact with people. They lose their social skills, and they don't have any motivation or energy to do things. So they kind of seem to lose their will to live, and pranayam can change that. Other symptoms of schizophrenia like hallucinations and delusions and disorganized behavior don't respond as well. But there is, again, conflicting evidence for that also. All right, and finally, to end, I just want to leave you with this quote from B.K.S. Iyengar, who died 6 or 7 years ago. He is probably one of the foremost practitioners of Iyengar yoga, popularized yoga in India and around the world. And in 2004, he was named by Time as one of the 100 most influential people in the world. And he said that yoga teaches us to cure what need not to be endured and endure what cannot be cured. Why I put this quote down here is because it is very highly relevant to what I do on an everyday, daily basis. I see people who have lost family members, have had financial loss, have been in accidents, and it has destroyed their emotional and mental health. And one of the biggest barriers for them getting better is that they they are still struggling to cure what cannot be cured. And sometimes people have to learn that there are things you just have to live with and get used to, and then there are things that can be changed and you should cure, and that is exactly what this quote says. And I think I've probably gone a little bit over time, and hopefully people are not too bored. Thank you so much, Kusuma and Nagesha, for allowing me to do this. I really appreciate it, and thank you everybody for listening patiently.
Yeah, thank you so much, Dr. Ali. Now, I think you can take off the PowerPoint.
I'm trying to.
Yeah. That's
Is
okay.
it,
Now I'll
is it gone?
show. Yeah, now it's done. So now, as Dr. Ali gave you a lot of information about how yoga is relevant in managing our mental health, and it helps us to maintain a good, it aids us in maintaining a good mental health. So I'll just put up a small PowerPoint, and we as teachers of yoga, um, we do certain practices so that we help in maintaining a good mental health. Apart from taking, as Ali said, for some stuff like medication is a must. So with taking medications and doing certain physical activities and breathing exercises and meditation, you can manage yourself very well, and you can um, uh, minimize your anxiety, your depression, and it will become more manageable. So we as yoga teachers, we try to do that for the people. So everyday stresses and anxieties and stuff can be easily managed by practicing yoga. So usually for anxiety and panic attacks, like we use gentle and calming poses, and we target the root chakra. So last session when we did with Dr. Anil, we learned about the root chakra. The root chakra is like what you are, and connected to the earth, and it is like you understand and you have a firm grip of who you are. So, and we practice some pranayama techniques, and as Ali told about mindfulness, so mindful meditation that helps a lot in dealing with anxiety and panic attacks. And we have all the asanas for the root chakra. So maybe today we'll do a few. And then the pranayam practice, the Brahmari or the bee breathing, that is very good for combating your anxieties, and the mindful meditation. And then for people suffering from depressions, we usually target the heart chakra. So usually forward bends and backward bends are really good. So that helps in your opening up your heart, because heart chakra is all about loving love. So it is loving yourself. If you love yourself, then you can love the world and you can love others. So we have some asanas for the heart chakra. Last session too, we did few asanas, and today maybe if time permits, I'll show you some asanas. And then the sun salutations, we did that with Dr. Shashi Prabhakar. So those are good for people with depression. Then pranayam like Kapalabhati, which helps to create your fire inside you, and It also helps in engaging your nervous system. So that is also a good pranayam practice, along with the other pranayam practices we have done. And then even any sort of meditation is good. And then for kids like who have ADHD and stuff, we try to include poses of animals or whatever in nature and make it fun for them. And we try breathing exercises and some of the poses that I have listed here. So if you make it as a fast moving class with lot of fun poses, and then it engages these kids and they will be able to concentrate. So today I'll try to show a few poses, and then we'll learn pranayam, the Kapalbhati and the Brahmari, and we'll do maybe a 3-minute simple meditation, a mindful meditation. So, first, let me show you a few asanas, and let me I hope you guys can hear. And now let me point to
Yeah,
the.
we can
Yeah,
hear Kusum.
okay. So let me point to the mat. And so, as I have told all the times, before doing any asanas, you need to do some warm-up exercises. So if you go to our first session, we have shown you the most of the warm-ups, what you need to do. So you can go back to the my Facebook page, or you can go back to the RKS Facebook page where they have uploaded that. So now let's today maybe I'll show some 5 poses so that you can incorporate with all the other poses we have learned in the first, second, and third sessions. So maybe these poses I haven't shown you, so maybe I'll just show you. So like if you want for concentration, like you can try the tree pose. People who are not comfortable with balance, they can hold the wall too, or you can stand freely, so whatever you prefer. So lift your right leg up and turn to the side, and then keep your right foot to your left leg, maybe little above your ankle, and bring your hands to the heart center. So this is a balancing pose and a concentration. So now you have to concentrate on a point in front of you, and any object or a point in front of you, and slowly concentrate, and then you will be able to stand in balance. Once you're comfortable with this position, slowly you can raise your leg up, and you can take your foot to your calf, to your calf, and then you can slowly raise up your hands. So in order to do this, you will have to concentrate on a point, drushti. You have to put drushtis to something, so that increases the concentration. And then once you're comfortable with this, you can always lift it to your thighs, and you can practice the same. So this pose will really be helpful for concentration. So it's very good for kids. Like you want to make them more focused and concentrated. And so these are poses which helps for balance as well as concentration. And now if you are targeting your heart, so I told you like you can do sun salutations and stuff. Other than that too, you can do the warrior pose, where you can stand at the edge of the mat, and while exhaling, take the right foot behind and look straight, and then inhaling, you bend your left leg at the knee and raise your hands up. So this is your warrior one or the Virabhadrasana one. and make sure that this left knee doesn't cross your toes. And the weight must be distributed equally between both the legs. So this is one pose which you can try, and then you can try the reverse warrior, where you can keep the right hand behind your right leg and raise your left hand up and slowly make a bend. So slowly do a backward bend and look up. So this is called as reverse warrior or Viparita Veerabhadrasana. So this pose is also very good for your heart chakra. And then inhale, and while exhaling, bring your leg forward and hands at the side of the body. Then you can do this for your left side too. So then for the root chakra, we have done a lot of exercises in the 3 sessions, but today you can do the cat and the cow pose, like be on your knees and keep a forearm distance between your knees and a forearm distance and a palm distance, and come up on your knees and palms. So make sure that your shoulders are aligned with your wrists and your hips are aligned with your knees. So when you inhale, relax your stomach and bring it towards the mat and look up, and you will have an arch in your spine. And then exhaling, round your spine towards the ceiling and look down. So this is your cow. This is actually your cat. Actually, this is your cow. Inhaling, cow, that is Bithilasana, and exhaling, rounding your spine towards the ceiling and looking down. This is your cat or the Marjari Asana. So this asana is very good for your spine flexibility too. Otherwise too, it is very good for your root chakra. And then you can do a forward bend. So you can do a seated forward bend. Usually when I've shown you standing forward bend. So a seated forward bend is you can bend your right foot at your knees and keep the right foot at the inner part of your left leg and sit straight, and inhaling, raise your hands up and stretch. Exhaling, bend forward, and wherever you can place your palms wherever it reaches, and then look down and breathe. So this is the seated forward bend or the Janu Shirshasana. And then slowly inhaling, lift your hands up, and exhaling, bring it down. So this is for the right leg. So you can again do for the left leg. And the last one is legs up the wall or the Viparita Karini. Maybe I'll ask Nagesh help for this, so that it's easier for me to give instructions. So sit towards the wall and show them how to put the legs up the wall. So this is also a good exercise. If you do this pose after doing all the poses, so it is an inversion pose and it is really good for you. So now sit towards the wall sideways and slowly put your legs up the wall. Start lying back and slowly put your legs up the wall and relax. So this is also a very good pose, and this also helps in engaging your nervous system. So all these poses help you in making you move from the sympathetic nervous system to the parasympathetic nervous system. That is, move from the fight and flight mode to a calm, relaxed state. So once you do the yoga, some people do shavasana in this pose, or you can just stay in this pose for 3 minutes and then do the shavasana. Then slowly come back and sit up. So this is known as Viparita Karani, or legs up the wall. So then we will do Kapalabhati. So we have done yogic breathing. We have learned the 3-part breathing, the abdominal, the thoracic, and the clavicular breathing. We did it in the first session. Then with Shashi, Dr. Shashi Prabhakar, we did the alternate nostril breathing. And today we will do the Kapalabhati and Brahmari. So these two also are very good for you. So this also engages your central nervous system. So now you can sit in, usually people sit in Vajrasana. That is, you sit on you place your buttocks or the hips on your heels and sit. If this is not possible due to knee problems and stuff, you can just sit in the normal Sukhasana or normal way how you sit, or you can sit on a chair. So now Kapalabhati is like you do passive inhalation and active exhalation. So now keep watching Nagesha. So when he exhales, he will be forcefully exhaling, and at the same time his belly will be flapping. So who should not do this? People who have high blood pressure and who have recent abdominal surgeries, who are pregnant, those people should not do this asana. So now let's start. So inhale and exhale. So you could observe that his belly was flapping, and when he was exhaling, it was forceful exhalation. So he was inhaling too, but that was passive. So this is Kapalabhati. So this is a very good this thing for people who have depression and stuff. It's a very good pranayam for them to do. And anybody who wants to do any pranayam, this can be also used as a cleansing technique. So you can do Kapalabhati first and then do all the yogic 3-part breathing, then the alternate nostril breathing, and then your B breathing. So it's a good cleansing technique. And now today we learn about Brahmari Pranayam. Brahmari Pranayam, or the B breathing, it's actually a good way which relaxes you. So for that, we usually we plug our ears. So maybe I'll take out the, I'll take out the, I'll take out my hand, the headset. And so we use a mudra called Shanmugi Mudra. So you will plug your ears with your thumb, and then you will keep your pinky near your mouth, and you will close with your index finger and middle finger, and you keep the, you close with your third finger, that is third finger and your ring finger, and you place the second finger, the pointer finger, at your temple or your foreheads. And then this is your mudra for it. So now this Brahmari breathing is when you breathe this, it is like how a female bee hums. So that's why it's called Brahmari. Brahmari means bee. And here it is the female bee, how it buzzes. So plug your ears and then keep this and keep the third finger and the fourth finger closing your eyes, and keep the second finger on your temple and touch the tongue to your upper palate and make the sound n, ta ta dha dha na, na na. So inhale while exhaling. So that is the vibration of the female bee. So you can try it once more. Inhale while exhaling. So you can do this 5 times. So it is actually the humming. It will be like a bee that will be humming. You can listen. So the whole of your head, that bee humming will be vibrating. So this is a very good asana to actually bring your emotional or mental state from anxiety or from a very depressive state to a very calm and balanced state. So this Brahmari breathing is very good. And then we will engage in a 3-minute meditation. So now you can sit on a chair or wherever you're sitting, just close your eyes. And if you are a visual person, you can visualize a nice place like a beach or a mountains or forest or something, if that appears for you. And we will attach a mantra in the mind. So when you inhale, you are going to chant so, and when you exhale, you're going to chant hum, and you're going to be concentrating on your breath. So this is a mindful meditation because breath is the present. And so you will always be in the present. If thoughts comes to your mind, just don't go behind them. Just break it there and come back to your breath and concentrate on your inhalation and exhalation and the mantra. So if you don't want soham and you like something else, so you can inhale while exhaling, you can say om. Or if you have any particular mantra like Mrityunjaya mantra or something which you like to chant, so you can be inhaling and exhaling and chanting that mantra in your mind. So now I will chant it for you. So everybody close your eyes and sit comfortably and sit tall, and then slowly inhale and exhale. So start concentrating on your breath. Now you attach the mantra Om to it. So inhale while exhaling Om. After 3 minutes, tell me. So you can time yourself, slowly come back to the room and slowly, whenever you're ready, gently open your eyes. So this is a kind of mindfulness meditation. So you're concentrating on your breath, because the breath is always the present, because you're breathing now. And then you have attached a mantra to be repeating in your mind. So your mind is also engaged with the mantra. So you won't, that's why, go into the loop of thinking what happened in the past, what's going to happen in the future. So all that has been cut. So you are in the present with your breath and the mantra. So this is a very good way to practice meditation, and it is one of the simplest meditation to do. So initially you can time it for 3 minutes. So you can keep a timer in your watch and you can do it. Or like you can also, there is an app called Insight Timer, where you can time for how many minutes, and after that minutes a nice gong will ring. So then you know that your time, you can set it for whatever time you want. So with this, this is a very good mindful meditation. I know it is difficult to meditate in the beginning, but this one is one which you will be in the present and concentrating on your breath and chanting the mantra in your mind. So it's one of the simplest meditation and anybody can do it. So try this out. So start with 3 minutes. Once you become comfortable with 3 minutes, slowly you can start increasing your time. And once you get practiced and you want to try new meditations, like you have the app Calm, like it's an app, and there you find guided meditations by people, but it's an paid app. So I think it's around $70 per year. So you have a lot of people there who do, they have like 10 minutes, 15 minutes, 20 minutes guided meditation. So you can, it's much easier if somebody guides you through your meditation so that you don't have to think. So they will be telling you what to do. So you